Our next medical expert is Dr. Chadi Alraies, and he is an interventional cardiologist with the Detroit Medical Center's Heart Hospital. Dr. Alraies will talk to us about the impact of heart disease on the African American community, as well as provide us insight and tips on how to address heart disease and stay heart healthy.
My name is Chadi Alraies. I'm a cardiologist at Detroit Medical Center. Heart disease in the African American community is a serious problem. As we know, 40% of the African American are more likely to have high blood pressure compared to non-African American. But the concern is that only 20% of them are properly treated and their blood pressure are on target. Moreover, as we know that blood pressure or hypertension is called the silent killer, which contribute to the risk of stroke and heart disease in African American population. Heart disease risk factors are, which is put your patient for a blockage in the heart and coming to the hospital with a heart attack with a 20% chance of dying, are high blood pressure, diabetes, smoking, and family history. But we know African American has more tendency to develop heart disease because they have higher blood pressure tendencies and more tendency to develop acute kidney injury and chronic kidney disease, which require dialysis. Heart disease symptoms in the African American population include chest pain that's described as chest pressure, or arm pain, jaw pain that radiates to the arm. But in women, we know that the symptoms are a little bit different, especially women above age of 60. Usually they present with indigestion or unable to swallow or having difficulty breathing more than the chest pressure per se. Therefore, you have to be aware of these symptoms. And remember, when you have such symptoms with the risk factors that we mentioned, which is diabetes, high blood pressure, dialysis, and family history, you have to call 911. It's a serious problem. During COVID-19, we noticed that there is a significant drop in the patient presenting to the hospital for a heart problem. In one survey we did in 15 hospitals in Michigan area, there was a 46% drop in the patient presenting to the hospital for heart problems. That means these patients are experiencing problem at home, but they are afraid to come to the hospital because they have the risk of getting infected. You are safe to come to the hospital. The hospital are meant to treat you and give you a safe and effective therapy without increasing your risk for getting infected with coronavirus. So when you have these symptoms, calling 911 for a chest pain, as I mentioned, or arm pain, jaw pain, indigestion, or difficulty breathing, this is an activation when you come to the hospital, to emergency department. They will run a series of tests, which be within 15-20 minutes. But the most important test is what's called electrocardiogram, which is you put leads on your chest and we look at the waveforms. And if that's serious enough, we're going to be bringing you to the hospital, to the cath lab, to open that artery and open that blockage. And if we don't do that, the risk of dying can be as high as 50%. So 1 out of 2 people will make it out. So the earlier you call, the earlier you could recognize these symptoms, the better. Moreover, recently because of COVID-19 and the delay of patients coming to the hospital, we noticed that these patients, they survive at home, they come with a dead part of their heart, and that puts them at risk for what's called heart failure. Heart failure means the heart pump is getting weaker, cannot pump as strong as it should be, and that causes fluid buildup in their lungs. They'll have difficulty breathing, swelling in the legs, swelling in the abdomen, and they think they are getting obese, but rather it's just fluid load. And more importantly, they have difficulty walking, climbing flight of stairs, or when it gets really bad, they have difficulty laying flat in bed and they have more than 2 pillows to set up. So these symptoms are indication for the heart pump being weak, and therefore also you have to come to the hospital to address this issue and to make sure that you are taking the proper medication to prevent your heart from getting weaker. The last thing I would like to mention is, in the African American community, it's very common to have what's called sleep apnea. So having your doctor screen for it, especially if you have family history of it, or if your significant other is complaining of you snoring. Sleep apnea is a serious problem and can cause stress on the brain, but more importantly on the heart, increasing your risk for high blood pressure and increase your risk for gaining weight, which is all considered risk factor for heart disease. So in summary, if you have chest pain, chest pressure, jaw pain, left arm pain, or indigestion, and you have risk factors such as high blood pressure and diabetes and family history, it's very important to check yourself by your primary care. But if you have any of the symptoms I mentioned, to call 911. We are here at DMC to help you and to control your symptoms, and prevention is our #1 goal. We aim for controlling your blood pressure and to give you the medication to prevent you from having these events that I mentioned earlier and to have an advanced heart disease. We have the team here to treat your diabetes, to take care of your kidney function, your blood pressure, and more importantly, to make you safe and enjoy your life and have a good lifestyle. Thank you for watching.